would love to test out GPT-4 and how it can be used in your field. Can you give us a demo about how it can be used as a co-pilot for doctors?
Yeah. So the thing that's been discovered is that GPT-4, without any kind of specialization, is extremely good at answering these types of what are called curbside consultation questions. Curbside consults are the kinds of questions that doctors ask each other. And this happens all the time, multiple times a day, particularly in general practice. Let's try one. Hi, GPT-4. I'm a doctor. I have a patient with some chest pain, elevated heart rate, but normal EKG. I've just measured and he has elevated troponin. What else should I be looking for?
Hey, Peter. Although I should emphasize that I'm not a healthcare professional, elevated troponin levels with chest pain and an elevated heart rate could potentially point to a cardiac event like a heart attack. In this situation, you might want to consider additional tests like coronary angiography to check for arterial blockages or an echocardiogram to evaluate heart function. Now, you're probably aware that other factors like kidney issues or muscle damage can also raise troponin levels. So having a complete clinical picture is crucial. Definitely consult with specialists to corroborate your findings. What's your current game plan for diagnosis and treatment?
Well, I'll definitely order an angiogram. Please let me know the urgency of that. Also, one thing I forgot to mention before is I did listen to his lungs, and I do hear some evidence of RALs.
Given the elevated troponin, chest pain, and elevated heart rate, I'd say the angiogram should be conducted as soon as possible to rule out or confirm coronary artery disease. Time is of the essence in potential cardiac events. The presence of rales in the lungs could suggest fluid accumulation, possibly indicative of heart failure or another condition like pneumonia. In light of this, you might also consider a BNP test to assess heart failure, or even a chest X-ray to get a better idea of what's going on in the lungs. So, all things considered, I'd say you've got multiple reasons to act urgently here. How are you planning to proceed?
Thanks. In fact, I think we can get that X-ray ordered at the same time as the angiogram, and I think that'll save a big step in the patient's treatment, so thank you. So that's a simple type of example, and these are things that doctors consult with each other all the time, but the access to that kind of information is oftentimes not present. When a doctor gets the initial presentation of a patient and some labs, initial lab test results, a doctor will develop what's called a differential diagnosis. Differential diagnosis is the list of possible causes for the patient's maladies with probabilities assigned to each one. A great use of GPT-4 is to give all that information to GPT-4 and say, take a second look at this. Is there anything I've missed? Anything else I should consider? We find that GPT-4 is almost superhuman at being able to critique the work that people do and be that second set of eyes.